I'm Bill Thrift, and I'm a family doctor in Prescott. So when we decided to do this, when we decided to do Terros, we didn't really know what to call it. We weren't really a clinic. We weren't really medical. And so we finally settled on that we were going to call ourselves a contact and referral center. Because a lot of the medical community was supporting us, and they were kind of saying, yeah, this is a problem and something needs to be done. You know, this was the time right as the Vietnam War was developing, and so a lot of people say, oh, were you a veteran of the Vietnam War? I said, no, I'm a veteran of the acid wars. And so I stayed home and took care of the kids. But we really needed some ideas how to do peer counseling and how to take care of people. And we were, kind of struggling with what we were going to call ourselves. We said, yeah, well, what we want to do is get people back to terra firma. And I flunked out of Latin in high school, and so I knew about that. And so they said, yeah, terra firma, that's kind of long. Why don't we just call it Terros? And so we decided on Terros, and actually my dad was a graphic artist, and so I said, okay, this is, design us a card. Part of what we did, responding to the need in the community is, along with some of the medical community, we started a free clinic. Some of the local doctors would come in and help us with that. And I found that very interesting. And so there was a time when I decided, yeah, this engineering stuff isn't going so well. I think I need to go to med school. I'm really glad I did. It made my life very full.
My name is Charles Arnold. I'm a mental health lawyer in Phoenix. I had been admitted to the Bar Association as a lawyer, having graduated from law school in September of 1970. Shortly after that, I practiced with a dear friend of mine, a fellow named Wayne Satz. It was my partner, Wayne, who identified Terros as a place that we need to be spending some time and seeing how we could contribute to the effort. We'd heard about these rebels that were operating a house that we then came to refer to as a crash pad for hippies on Fifth Avenue in Roosevelt. It wasn't necessarily a legal context that we thought we could help, but we wanted to contribute to the effort. What Terros did, which was provide service to people who had had a bad drug experience or were overdosing, was seen as something outside the mainstream of human service providers in our community at the time. And so Terros, in my view, wasn't looked at as a, quote, legitimate agency, if you would, among other human service agencies in the community. The people who served Terros, the people who worked at Terros, the people who began the organization, were extraordinary people who had a vision well beyond that of the existing human service agencies at the time. And so the relationships that were created in those early days of this fledgling organization became magnificent over time and still are relevant. No doubt my time at Terros informed my career.
My name is Cathy Paddack. I'm working in the MAT department, which is the Medically Assisted Treatment Program, assisting people who are opiate dependent. And this is where I started in 1985, dealing with doing outpatient detox at Terros when we were the Salt River Health Clinic. At that time, a lot of people thought we were from the Salt River Indian Reservation, so we were very mixed up. They wanted services for Native Americans, and we're like, no, we're an outpatient detox program for addicts. And they, oh, that's not what I'm looking for. So that name confused folks. So then they just incorporated into all of Terros. In 1985, we got the detox going, and we still had a clinic that people would come in with various issues, boils, colds, etc. Dr. Stavros would see them. We'd do physicals, but mainly we were treating people who were addicted to drugs. About 1986, that's when we started hearing about GRID, the gay-related infectious disease that was happening on the East Coast to drug-addicted people who were using needles, and on the West Coast to gay men. And so because I was already drawing blood from my IV drug users, the health department asked me, can you draw an extra tube, Cathy? We don't have enough people to run these AIDS tests. So Terros was the first behavioral health agency at the HIV prevention table. My clients are my energy. They're the reason I live. They've helped me get through many, many crises in my own life. And that's just it. You know, it's real hard to go home and feel sorry for yourself or think, oh, woe is me, you know, I don't have a new car, when somebody on the streets who barely has a blanket and a plastic bag to carry everything they own blesses you. So, you know, they are just incredible people, and they make you feel like, wow, I don't have anything to worry about. And obviously my purpose is to work with them, because that's what gives me life.
My name is Lilliana Molina. I started in 2005. The agency wasn't as big as it is now, so there's no unfamiliar faces. 32nd Street and McDowell site had trainings, had people coming in and out, so you knew what positions they were in. I really appreciated the monthly and then the quarterly trainings and all the trainings that Terros would offer. As a case manager, is being able to help a client in need. Most clients come broken with the fact that their children have been removed from their care. Some of them are in foster care. They have no clue where their children are. Their family has shut them out. They feel alone, they feel guilty, they feel all these horrible feelings, and you're the person to demonstrate to them that you're a form of support, that you still see them as humans and they're still valuable. And I think that that's rewarding within itself. From the first time you meet them where they're broken and they're in tears, or they're cussing you out because everybody's against them, to them coming up to you and saying, thank you for what you've done, for being there for me. The cards that they send you and just the gratitude is rewarding.
My name is Maria Torres. Family's First program started in 2000, and it was a coordination, I believe, from DES and DHS, and I believe that one of the contract was given to Terros, and then they started the Family First program. It was a very great experience. I worked as a case manager for about 8 years. Now that we have this integration of care, it's kind of more approachable for the client to know, hey, you know what, I can get everything in one place. I don't have to go to one clinic for the other and the other. No, you're going to get everything in one place, and you're going to be cared for. We're going to take care of you. And that's what gives them the confidence to come to us. I see that more often now.
When I started here, I'm pretty sure that our team didn't even have a laptop. And since then, we've gone from X number of laptops per team to tablets for everyone on the team, which has really made it much easier to be out of the office and get the documentation done. The EHR, the electronic health record, is another change since I've been here. Being able to access information about what has happened in the past and the primary case manager's plans for the future, that's very helpful. My name is Susan Gerber. I am currently a recovery coach, and I love my job.